Hello everybody, it's nice to see you again. Today I want to talk a little bit about medication-assisted treatment for opioid use disorders. If you live in the United States, there's a 1 in 2 chance that either you struggle with an opioid use disorder or that you know somebody that does. It's an all too common disease in America, especially since the mid-90s when the opioid epidemic started. In previous videos, I talked a little bit about Narcan, which is overdose protection medication and is really an essential medication for anyone who either struggles themselves or who knows someone. In fact, even if you don't know someone, it's just an important medicine to have around, just like EpiPens, and AED devices. I believe that they should be kind of widespread and available because we're unfortunately seeing people overdose in all types of areas. The medication-assisted treatment that we use for opioid use disorders, aside from Narcan, which is to prevent overdose, are 3 kinds. The first one is methadone, the second one is buprenorphine, and the third is naltrexone. Methadone is a medication that's been around for a long time and is really one that you have to get out of a federally certified center. It's not something that you can get from a general doctor's office. It is something that can help with cravings to use, as well as decrease the ability to get high from other opioids. Although it is something that, because of the way it acts on the opioid receptor, is something that can lead to overdose and sometimes has other medical complications in terms of how it might interact with other medicines. But it is something that, because of the nature of how it's distributed, which is usually on a daily basis through a health center, is one that we find that people really stay on the longest, and also is one that helps people engage in other services, either for psychiatric reasons or to help treat their other infectious diseases. So it's got a lot of pluses and minuses, as do all the medicines for this disease. The second medication is buprenorphine, and that is something that's kind of in the, commonly the brand names are things like Suboxone or Zubsolv. Those are medications you can get through a doctor's office, including our office at Whole and Healthy U. And there are new injectable forms of it, something called Sublocade, which means that you can get an injection once a month. Buprenorphine generally, though, is dosed under the tongue every day, and it also has a couple of different benefits. On the one hand, it can help really with cravings and stop withdrawals from opioids, but it doesn't work in the same way as other opioids, so it's very hard to overdose from. Both methadone and Suboxone are in the opioid family, and so there is potential to misuse them, and they also require detoxification, which can sometimes be complicated because they're very long-acting drugs. But they are also medications that there's a lot of evidence that they actually can improve your life expectancy, especially if you're somebody who has really had a lot of struggle with an opioid use disorder. The third medication that's FDA approved for opioid use disorders is naltrexone. Naltrexone actually blocks opioids and is also a medication that you can take for overdose prevention. So it's a cousin to Narcan or naloxone, which we talked about before, and it's something actually that you take before you try to get high to prevent you from being able to get high. There's a pill form that you can take every day, and there's also an injectable form that you can take once a month, which can be particularly helpful because it's not something that you can really cheat. So once it's inside, you really just can't get high for that whole month. It is not something that activates the opiate receptor in the same way, and so it is not something that needs to be tapered or something that you have withdrawal from. And in one trial, it was shown to be just as effective as buprenorphine in helping control cravings to use opioids. So all 3 of these medications are really life-saving medications for folks who struggle with opioid use disorders. And some people think that, if you're on especially methadone or Suboxone, but sometimes even naltrexone, that you're using a crutch to stay healthy and that you're not really sober. But I would argue with those people, and we talked in our previous video about why. I think especially with how high a risk it is to die from an opioid use disorder, utilizing medications like these can be incredibly important in not just staying healthy but staying alive. If you have questions about any of these types of medicines, or if you're interested in getting on them, your primary care doctor can be a start, but usually seeing an addiction medicine specialist or an addiction psychiatrist is one way to safely get on these medicines and be monitored on them. It was a pleasure to see you again, and I hope until I see you again, you're well.